Ji. Hello and welcome to my channel Chess Mose. Today we're going to discuss about the invention or you can say discovery which take a miracle turn in the medical science. Before we start our episode, I would like to put the disclaimer that this is not a educational or medical video. This is just informative video. It's more about the information I would like to share about the development and the miracle which took place in the medical history and medical line. So, if the information, whatever I have passed to you guys, it can be not 100% correct, but I have tried to do all my research and make sure that whatever information I provided, it's true and accurate. So before I start my channel, I would like to ask you one question. So my question is, how would you react when you see or someone say that that person can see by their teeth or tooth? How does it sound to you? Is it sound okay? Or you are aware of this, or it sounds like something stupidity, how a person can see through their teeth, right? It's a totally different functionality of a human body. So how can a person can see through their teeth or why their teeth? So that my reaction also the same when I see this article for the first time, when I heard about that the people can see using one of their teeth. How great is that, right? What is this about? This is a process called osteodonto keratoprothosis, something like that. My pronunciation can be wrong because I'm not sure what the correct pronunciation. So also known as OOKP, sorry, osteodonto keratoprothosis, OOKP. Yeah, that's it. So this is a process where the person who lost their vision doctor remove one of his tooth with muscles and flesh like your skin, and then they do the treatment and then they install the tooth within your eyes. So let's have a little bit of background. Who are the eligible for this kind of process, and what can be the reason and the process is going through. Okay. Any patient who lost the sight fully for both of the eyes are eligible for this process. So there are a few criteria, like they have done all the research, investment of time and research before they ask for this treatment. This should be like they have exhausted all the treatment, like the doctors say no to all the other treatment to restore the sight. It is very complicated process and very time consuming and take time to heal. So you have to be prepared for that. Also, it may affect your look after the treatment because it doesn't look like our normal eyes. It have something like skin over your eyes with one bullet hole kind of thing, which look obviously can be visible for the people who have been through this process. Other criteria, like the person who having go through this treatment shouldn't have any optical nerve damage or shouldn't have any the retina damage. It's overall only the eye socket. It's like a damage on the upper part of the eye, not the internal injuries. Secondly, must have healthy oral teeth. Okay, must be maintain oral hygiene like sins, and his gum, teeth, and tissues, cheek tissue, cheek muscles need to be healthy. Again, if the person is want to go for this treatment, must be make sure that he is mentally prepared for all this thing. Also, if the person is growing, like a teenager growing, still growing, right, there are possibility for him for physical growth, then also this treatment cannot be given to them. Like there are chances that they may grow, and this treatment may not as effective for as compared to fully grown up child. So who are the general patient for this kind of treatment? Who people undergo this treatment? People who have thermal burns on their face, they burn their eye, the upper part, but their retina and their optical nerves are fully saved, unaffected. Only the upper layer is burned. And then there is any kind of a trauma, like any trauma or anything, and also exposure, serious exposure to the keratopathy. And another, there is one more disease, it's called Sergom syndrome or something, I'm not sure, but in that problem, the person, the gland which moist your eyes or moist your mouth, all the thing where the moisture is requirement, that stop functioning. So that also affect you to loss of your vision. So yeah, these are the normal, these are the patients who undergo this treatment. So what are the side effects? What is the let's talk it. What is the treatment? So what they do, they take out the complete tooth with your muscles and gum, the skin you can say, and then they like they mold it, they carve it in the shape of the lens, the shape which they want, and they make sure that muscles and tissue are still intact with that tooth. And then they insert to your one of your cheek, or in some cases they use the chest also. So they let it be there for few months, I can say 2 to 3 months, for the tissues and the nerves to be grown to connect. So after 2 to 3 months, they put the eyes, install it in your eye, and then they take the muscles or flesh from your cheek, and then they cover it. So this is how the patient who undergo this process look like. I am sharing this photo, so you can see how does it look like. And there are complications, like the mental breakdowns, the people who look into the mirror, they are not happy with their overall look. Then after the surgery, you have to sleep like in the proper upright position for at least 2 to 3 months. And also there are chances of infection, oral infection, and the tooth which has been extracted, the tooth next to those them, the gums and roots are visible. Plus there are chances that you having oral infection, there are chances that you having what you call stiffness in your jaw, stiffness in your, and numbness in your jaw. You may having an issue with your jaws after the removal of tooth, after the removal of tooth. So yeah, there are like, these are the side effects which can be overcome after a treatment. But at least the person who lost their eyes, the person who give up all their hopes, the scientists give them like a hope to them, they can able to see. And do you believe what will be the success percentage for this treatment? Like so far, how many treatment is been done? What is the success percentage, the rate of success operations? Uh, on an average, it's 94%, which is also very impressive. So yeah, the people who can able to see back, it's a boon to their life. They can see, they can view, they can explore the world again. after losing all the hopes. So this is all from my side. Again, I will come with a new episode with a new information about the technology, about the space, about the sea, anything it can be. We will continue with our videos also and the interviews as well. So don't get confused that sometime it's late, I'm having a guest, sometime I'm making a video alone. So yeah, I will be sharing up the content like this. So keep connected to my channel, and thank you for your support. Have a nice day to you. Bye bye.